Hey everyone, my name is Stan and I'm a licensed pharmacist. I want to welcome you back to another episode of How Do I Take This Medication? Today, we're diving into an antibiotic called nitrofurantoin, also known as macrobid. So let's break it down. Nitrofurantoin is a prescription antibiotic in a class of drugs called nitrofuran derivatives. It's been around for decades and is a tried and true option for treating uncomplicated urinary tract infections or UTIs. Uncomplicated UTIs usually mean infections in otherwise healthy individuals with no structural or functional abnormalities in their urinary tract. Nitrofurantoin works by stopping bacteria from growing and spreading, so your body's immune system can kick it out. Nitrofurantoin is a first-line treatment for simple UTIs, often caused by Escherichia coli or E. coli, which is responsible for about 80% of all UTIs. It's particularly great for lower urinary tract infections, like bladder infections called cystitis. But it is not suitable for more severe infections like kidney infections called pyelonephritis, or complicated causes involving anatomical issues or recurrent infections. In those cases, your healthcare provider might prescribe a different antibiotic. Here's a fun science fact. Nitrofurantoin is a prodrug, meaning it becomes active when it enters your body. Once absorbed, it concentrates in the urine where it kills bacteria by damaging their DNA and other critical processes. This is why it's so good for UTIs, but also why it won't work well for infections in other parts of the body. Macrobid is typically prescribed twice daily, with doses spaced about 12 hours apart. Taking it with food is important because 1, it improves absorption, meaning more of the drug gets into the system, and 2, it reduces stomach upset, a common side effect. Make sure to drink plenty of water. Staying hydrated helps your kidneys flush out the bacteria along with the medication. Complete the full course. Even if you feel better after a day or two, don't stop taking it early. This helps prevent antibiotic resistance, which is when bacteria becomes harder to treat with antibiotics in the future. Like any medication, nitrofurantoin has potential side effects. So let's start with the common ones: nausea and vomiting. This happens in about 10 to 20% of people. Diarrhea or loose stools, headaches are another common ones. Here's a tip. If you feel nauseous, take the medication with food, usually helps. Now let's talk about rare but serious side effects. These include 1. Pulmonary reactions. They can be acute or chronic. Acute or short-term can cause cough, fever, and difficulty breathing. And chronic or long-term can lead to permanent lung damage. But again, it is rare. Peripheral neuropathy is another one. This is nerve damage that causes tingling, numbness, or pain in your hands or feet. It's more common in people with diabetes or kidney problems. Liver toxicity is another one. Signs include yellowing of the skin and the eyes. Allergic reactions is another one, like rash or hives. So let your doctor know if this happens. If you experience any severe symptoms, stop the medication immediately and seek medical attention. Here are some key things that make nitrofurantoin unique. It's safe during pregnancy, especially in the first and second trimester. It's often a go-to for treating UTIs in pregnant patients. However, it is not recommended close to delivery due to a risk for newborn jaundice and hemolytic anemia. So do not use it at term, meaning 38 weeks or more. It's not effective for kidney infections in systemic infections because it doesn't achieve high concentrations outside the urinary tract. Nitrofurantoin works best when kidney function is adequate. If someone has poor kidney function, their provider may avoid it because the drug won't concentrate properly in the urine. Resistance to nitrofurantoin is relatively low compared to other antibiotics. That's great news for maintaining its effectiveness in treating UTIs. So always take your antibiotic as prescribed and don't skip doses or stop early. Got questions? Drop them in the comment. I want to give a shout out to my colleague Vanessa for helping with this content. Don't forget to like, follow, and share this video with anyone who might find it helpful. Stay healthy and see you in the next video.